I'm a fellowship-trained breast surgical oncologist. I'm Dr. Amani Jambakar, and a question I get all the time is, if my oncologist or my surgeon said that my breast cancer is a little bit more aggressive and more likely to come back, then should I choose a mastectomy instead of a lumpectomy to decrease the chance that the cancer will come back somewhere else in the body? Short answer is no, and let me explain more. This is a patient who could either choose a lumpectomy, or just removing a small part of the breast that contains the lump or the cancer, or a mastectomy, which means removing the entire breast. Let's say that she chose a lumpectomy and that after her surgery, they found out that her oncotype score was 41, meaning that this estrogen and progesterone receptor positive cancer was more likely to come back somewhere else in the next 9 years. Choosing a mastectomy or having the whole breast removed would not have made a difference in what the likelihood is that the cancer comes back. This is a study from 2025, which looked at how likely breast cancer is to come back somewhere else in the body if someone chooses a lumpectomy versus someone choosing a mastectomy, even for patients who have a little bit more aggressive types of cancer. It agreed with studies that have already been performed that showed that choosing a mastectomy only impacts the likelihood of the cancer coming back in the remaining breast tissue or on the chest wall or in the lymph nodes. It does not impact how likely the cancer is to come back somewhere else in the body. Because the way that cancer can spread to other parts of the body is through the blood. So choosing a lumpectomy or a mastectomy makes no difference if there's already cells in the blood that are waiting for your immune system to be down for some other reason to start growing somewhere else in the body. So back to this patient, she does have a slightly more aggressive breast cancer, but that doesn't necessarily mean that she has to choose a mastectomy. The thing that makes a difference in how likely cancer is to come back in other parts of the body is systemic treatment. So for this patient, chemotherapy was recommended and she did take it, so her cancer did not come back.